Hi, I'm Dr. Kurt Wohler for Integrative Medicine Academy. The title of this video is Inside the Future of Medical Training, Behind the Scenes Tour of the new Integrative Medicine Academy. So, practice and education challenges, we all have them. From a practice standpoint, time constraints on patient care, complexity of patients, particularly those suffering with chronic health problems, and just the frustration and time limitation on how to implement testing and various treatment options can be challenging. We also have issues with regards to education, challenges, time constraints there as well, financial burden, traveling, conference fees, hotels, and then just conference fatigue. Now, there are some options. We can do self-study, finding the right material to study, not having enough collaboration with others for questions and answers can be problematic. We can try webinars. These can be useful, but often don't provide in-depth details, particularly on test interpretation and treatment options. And then we're all required for CME conferences and lectures. We all need these for licensing and up-to-date certifications, but they often lack depth with regards to products and that what to do next. And then, of course, there's always the trial and error, which usually doesn't work out. So at Integrative Medicine Academy, we have created a wide variety of educational material that is easy to access right from home and from your computer. So we have individual, what are called mastery courses, and then specialty core tracks. And this new website was developed based on feedback from alumni. They were looking for lower tuition, on-demand courses, tracks that were consisting of complementary courses for maximal learning, various membership levels, and then also access to one-on-one mentorships. So I'm Dr. Kurt Wohler. I am the co-founder and education director of Integrative Medicine Academy. I've been a practicing clinician since the late 90s. I do a tremendous amount of speaking as well as clinical education. Again, I'm founder and clinical education director for Integrative Medicine Academy. I'm also the founder and education director for something called Autism Recovery System. I work as the chief medical officer for Mosaic Diagnostics Laboratory. And then I have my own podcast called the Functional Medicine Doc Talk podcast. Now in clinical practice, I work a lot with individuals on the autism spectrum, but also individuals who are dealing with other kinds of chronic and environmental induced health conditions. I'm joined in Integrative Medicine Academy by my partner, Dr. Tracy Trancatella. You can learn more about us if you actually go to the About Us section and look under Instructors. So the first place you want to start is the home page. We can see the tab up above. We've got home, courses and tracks, membership levels, resources, etc. Let's look at courses and tracks. So we currently have an extensive list of mastery courses, from functional medicine mastery to autism to advanced organic acid test, hormone, candida, mitochondria, etc. And then we also have the specialty core tracks. So if we click on that, we can see there are 4 core tracks: functional, autism, hormone, and mitochondria. If we look at functional medicine track, we can see that it requires 3 courses: the functional, the toxicity, the advanced OAT mastery, and then the essential OAT mastery course, for a total of 43 modules for that particular track. Let's take a look at the toxicity mastery track, because this is a very popular, important course that many people take to learn more about environmental exposures. So if we go to the web page, or the section, I should say, for the toxicity mastery courses, a video link to each of these mastery courses. This is a 9-module course with over 20 hours of lecture material. And so I'm just going to go through just a little bit of the type of content you get within our mastery courses. So mitochondria. they're in our cells, they make the energy, and a major part of our mitochondria is the electron transport chain, which sits within the inner mitochondrial membrane. And we know that there are various toxins. Rotenone, for example, is a specific insecticide that is known to interfere with complex 1 of the electron transport chain. Cyanide, carbon monoxide damage complex 4, for example. And when some of these complexes are damaged, particularly complex 1 or complex 3, we get tremendous electron leakage into the matrix of the mitochondria that then reacts with oxygen. And that formation of oxygen radicals, because of the electron leakage, can cause not only damage within the mitochondria, it can damage mitochondrial DNA, but if it gets extensive enough, it might damage nuclear DNA. So for example, if you just took a common free radical, it has an unstable electron shell in its outer shell. It wants to get it more stable, so it wants to grab an electron or two, for example, from something else. So in this particular case, it could be grabbing an electron from DNA that stabilizes the radical, but it leaves damaged DNA behind. And one of the reasons that we have antioxidants is the antioxidants step in, donate an electron to disallow, if you will, that free radical from actually doing damage. And what's important about mitochondria is mitochondria have their own DNA. In fact, it codes for 37 genes, 13 of which are specific for those electron transport chain complexes, 1, 3, 4, and 5. So again, free radicals can damage the mitochondria by damaging their genetics, but they could also damage nuclear DNA as well. And so a couple things to keep in mind is that when we are damaging or interfering with the genetic sequences, we're going to have problems as far as the types of proteins that get formed. So a base pair, for example, within our DNA is adenine pairs with thymine, cytosine pairs with guanine. So a base pair essentially is just the joining of these two nucleotides. So cytosine guanine is a common pairing. Well, there are chemicals that contain a group or what's called a functional group or a configuration called epoxide. And most epoxides are toxic because they're highly reactive. This reactivity in biological systems also makes them mutagenic. Now, in our body, we have what are called hydroxides and thiols. So various compounds like glutathione and N-acetylcysteine, for example, are thiol-based. And these epoxides will go after these thiols. So that's why we have glutathione, for example, to kind of help buffer against epoxide reactivity. The problem is epoxides are also reactive to our DNA, specifically at the guanine cytosine pairing. And if we look at something like the ToxDetect profile from Mosaic Diagnostics, there's many different kinds of chemicals that are analyzed. One of the things that we unfortunately can be exposed to, but it can be detected, are benzene. And benzene or different forms of benzene come from various environmental sources. So incomplete combustion of organic matter, gasoline, diesel exhaust, cigarette smoke, charcoal broiled foods, for example, can be sources of this particular type of benzene called 3,4-benzpyrene. What I want you to recognize is as this is being metabolized, it forms a particular form of this benzopyrene that has that epoxide configuration on it. And as it gets metabolized, it damages the DNA. Now, there are other examples of epoxides. So we can see this epoxide form here, for example. There's epoxides on bisphenol A. Benzene oxide, for example, gets formed into an epoxide. And benzene, for example, comes from air emissions. So we can also get it where it's used in solvents for fats, waxes, paints, ink, plastic, rubber, cigarette smoke, and essentially all forms are carcinogenic, no matter how you're exposed. And so the Toxitect profile, for example, from Mosaic Diagnostics looks at benzene. Well, bisphenol are compounds that we get exposed to through plastics. And here's BPA, bisphenol A, for example. We can see it's got 2 epoxides. Well, BPA, for example, is damaging to our cells, particularly of the mitochondria. And it can also damage DNA. And if we damage too much mitochondria, we get what's called apoptosis of the cell, and that's premature cellular death. And so BPA for exposure is linked to a lot of problems: brain developmental issues, reproductive problems, cancer, cardiovascular illness, for example, immune system problems. Well, there's something else that we can be exposed to, and that is some of the mycotoxins of mold. Now, Stachybotrys is that greenish black mold. Usually takes a lot of moisture for it to be able to grow continuously. And mycotoxin testing will often detect the presence of Stachybotrys mycotoxins like verrucourin A. This falls in the category of something called trichothecenes. So trichothecenes are a group of mycotoxins, in part being produced by Stachybotrys. But if you notice, each of these, ryordan E, verrucourin, satratoxin, and even T2 toxin all have that epoxide structure. So these are extremely toxic to our cells and to our mitochondria. Now, if we go back to the website, under resources, we have an article section. And there's a host of articles that you can look through. These get archived and loaded over time. And these are just a few examples: gliotoxin from aspergillus, the hidden dangers of mold, and mycotoxins are available in that resource section. And then we also have, under the resource section, events and find a practitioner. So find a practitioner is a practitioner directory. So if you become a member of Integrative Medicine Academy, you can get hosted or posted within that section. And then we also have an events page. The events page gives an update or an idea of upcoming webinars. So this video specifically is linked to a webinar that we did on this particular topic. You can see here another webinar coming up, and then a monthly mentor members clinical round case study. Now, where the benefits really come about within Integrative Medicine Academy is within the clinical videos and the IMA, or the Integrative Medicine Academy Mentor Q&A section. So the clinical videos provide a library of videos that go into great detail into different type of topics. So this particular topic here, autism, leucovorin, and cerebral folate deficiency, is about a 20-minute video detailing information about the use of leucovorin in autism on aspects of cerebral folate deficiency, and there's many other topics as well, from mold, from lab testing to organic acid test interpretation, etc. We also have a private forum within the website where you can post questions. And then we have a couple different membership levels. So the IMA member, now the prerequisites is that to become an IMA member, you must have completed or are currently enrolled in at least one of the integrative medicine courses that you see listed. Now the benefits is a 20% discount on future courses, extended access to previous courses taken during active membership, and then you get an unlimited access to the private forum listing on the Integrative Medicine directory, and then also access to the clinical rounds videos. In addition, you get a window decal and a web badge identifying you as an IMA member. Now, the IMA mentor member, the prerequisites is that you must have completed or are currently enrolled in at least one of the Integrative Medicine Academy specialty tracks. Like I mentioned before, the functional mastery track, but we also have autism mastery track, hormone mastery track, mitochondria mastery track. You also get everything in the IMA membership. In addition, you get access to monthly Q&A sessions and private one-on-one virtual, that would be phone or Zoom, mentor consultations with myself, Dr. Wohler, and or Dr. Trecatella. We get a total of 4 per membership year. So you can look through the membership section to learn more about the different types of memberships and current pricing. So check out the website. Again, there's a lot of different sections: the courses, the tracks, the membership levels, the resource section. And then we also had a request for merchandise, interestingly enough. So a number of people who've gone through the courses or are current members wanted to know if we had any types of merchandise. So we came up with a number of things, from mugs to hats, as well as apparel, so t-shirts, etc. So you can check out shop for those offerings. And then if you go under About Us, again, I mentioned the instructors. There is a section for frequently asked questions. So this is an extensive list. This is just a short screenshot of this, but it goes through all the different Q&As that people have asked over the years. We try to provide as much information here in the FAQs. And then to contact us, easiest thing to do is through the website, integratedmedicineacademy.com. And if you have any questions, you can always email us at admin@integratedmedicineacademy.com. Again, I'm Dr. Kurt Wohler for Integrative Medicine Academy. Thank you.